أهلا بيكم. Today we're going to study the larynx. Now you notice that we have concluded the upper digestive tract. I thought it's better to, when we study the pharynx, we proceed to the oral cavity to conclude the whole thing, not to be separated from it for a while and then come back to it. It will lose consistency. So you expect that we will start with the larynx to conclude the neck. There will be only a small part left, which is the suboccipital triangle. And after the larynx, we will proceed to the nasal cavity, and then we will go to the temporal, infratemporal fossa and face and parotid, and jump into inside the skull. Okay, this is the plan. Today is the larynx. I decided to make it in two parts for you to be easier to follow up and study and not to get bored from all the information in each lecture. The larynx is a device of ligaments, muscles on a cartilaginous framework. This is the larynx. It's on top of the respiratory tract, the trachea. So it opens upwards, remember, by the inlet into the oropharynx, and downwards opens into the trachea. It's why do we have such a device? To put a device in the way of air, this will provide a resistance. The resistance will produce sound. So this is actually a sound producing device, and it has to protect the respiratory tract from the common foodway and airway in the oropharynx. So that's why it has the epiglottis as a shutter mechanism, that whenever you swallow, you pull up the whole thing upwards and compressing the epiglottis downwards to close the airway. Okay, this is a simple idea about the framework of the larynx. Now, we said on a cartilaginous framework, let's study the cartilages. The first cartilage is the cricoid cartilage. This is the cricoid cartilage. You will notice that it's a complete circular cartilage. So it is the only complete circular ring in the respiratory tract, if you are asked about this. The only complete ring, because the tracheal rings are not complete. Remember, it's like a capital D, open backwards because it's occupied by the trachealis muscle. This is the only complete ring. Actually, it's like a ring, like a signet ring. It has an anterior arch, see that? And you can call all this the arch of the cricoid, and a posterior broad lamina. This is the lamina of the cricoid cartilage. It has a ridge on it, a median ridge, produced by the attachment of the esophagus. Don't be surprised. Yes, the esophagus is attached to the back. The beginning of the esophagus is attached to the back of the cricoid cartilage. Don't forget that. So we said it's like a signet ring. It has an anterior arch. It has a posterior lamina. When you look at the sides, you will find a facet or a smooth surface, articular surface. This is for articulation with the inferior cornea of the thyroid cartilage. You will get another facet on the top. This is called the shoulder of the lamina. See, shoulder of the cricoid lamina. You have two other facets to articulate with the on top arytenoid cartilage, the triangle or pyramidal cartilage at the top. So it articulates in four sides, two on each side. Superior one with the arytenoid to form the crico-arytenoid joint. Now I want to tell you something about the name of the structures. Lots of names. Now the good thing about this, that you can save yourself by inventing your own name. Yeah, I mean, if there's an arytenoid cartilage here and the cricoid here, so you can call it cricoid joint or cricoarytenoid joint. Just make up the name and you will get to it. You will get the right name. Don't worry about names. Cricoarytenoid joint formed at the top, at the shoulders of the lamina of the cricoid, and at the sides with the inferior cornea of the hyoid bone, and we will get to the hyoid bone soon. Okay, that's it about the cricoid. We will get to it, of course, when we get to muscle attachments and such. Now, this is the biggest cartilage in the respiratory tract. This is the thyroid cartilage. It's made of two laminae. This one, and this is the other one. This is one lamina, and this is the other lamina. Joint anteriorly at the midline, and joint at an angle. See? Angle. Now, this angle differs between males and females. In females, it's around 120 degrees. In males, it's about 90 degrees. So it's narrower in males. When you make the angle narrower, means that the angle will protrude anteriorly more in males. This is called the laryngeal prominence. See that? This is the laryngeal prominence, or Adam's apple. It's more prominent in males rather than females. And because of the angle, you have superior notch, inferior notch, guarding the tips of the angle of the thyroid. So you have two laminae, a joint at an angle. The angle differs between males and females, and it has two notches, and the protruding part is called the laryngeal prominence. Okay, what else? Now, this lamina has upper ridge and lower ridge, and project posteriorly into two horns. The superior horn, or cornea, inferior horn, or cornea. Superior cornea to articulate indirectly with the above hyoid bone, thyrohyoid joint, and inferiorly, we said it articulates, it has an articulation surface on the cricoid. This is the inferior cornea that articulates with the sides of the cricoid to form the cricothyroid joint, or thyrocricoid joint. It's the same, cricothyroid joint, okay, at the sides. So we have inferior horns and superior horns. If you're asked, the superior horns are bigger than or taller than the inferior horns, okay? Above, it provides the attachment for a very important ligament here. It's called the thyrohyoid ligament. We'll get to that now. Okay. On the lamina 2, we have tubercles, superior tubercle and inferior tubercle. Between the tubercle, there's a ridge, elevated ridge line called the oblique line, oblique thyroid line. This is the one we were talking about in the pharynx when we discussed the thyropharyngeus, for example. It attaches to the oblique line going backwards. This is the one we mentioned in the infrahyoid muscles when we were talking about the sternothyroid. The sternothyroid inserts into this line, and the thyrohyoid originates from this line. Remember when we said that the sternothyroid and thyrohyoid, they were one muscle but attached to the oblique line? This is the oblique line on the side of the lamina. So if you're asked about the oblique line, it gives attachment to three muscles: the thyrohyoid muscle, thyrohyoidus, the sternothyroidus or sternothyroid muscle, and the thyropharyngeus, the part of the inferior constrictor of the pharynx. Don't forget that, okay? This is all about, you can say, about the thyroid cartilage. It's simple as long as you understand the features on the cartilage. Now we have a very unique and prominent cartilage called the epiglottis. Epiglottis means above the glottis. The glottis is the laryngeal cavity. It guards the laryngeal inlet. It's leaf-like. See? It has a pedicle and expanded end. With its anatomical position, it has a posterior or postero-inferior surface, this one. It has on the other side the anterosuperior surface that faces the oral cavity. So you have a postero-inferior surface facing the laryngeal inlet. You have an anterosuperior surface facing the oropharynx. What do you expect about the mucosa covering? Exactly. The mucosa covering the postero-inferior surface is respiratory epithelium, pseudostratified columnar ciliated epithelium with goblet cells. But the mucosa covering the anterosuperior surface belongs to the oral cavity, oropharynx, which is the stratified squamous epithelium. A big difference between the oral mucosa and respiratory mucosa. Don't forget that. What else? It has an edge here that provides attachment to a very important ligament. We will talk about it. It's fenestrated. See? Lots of fenestrations. And on the posterior surface that we are looking at now, there is a midline ridge or eminence, tubercle. You can call it whatever you like. It's a protrusion. I think this provides, to complete sealing of the laryngeal inlet when it comes down opposite the laryngeal inlet during swallowing. So it's a leaf-like. It has a pedicle. Ah, yes. Now, how does it attach to the rest of the cartilage? It's attached to the back of the angle of the thyroid. Remember the angle of the thyroid? Back of the posterior surface of the angle of the thyroid. And it's attached by a ligament, thyroepiglottic ligament, that connects the thyroid to the pedicle of the cartilage. It's drawn in yellow because it's elastic, and we will talk about that soon. Another cartilage, arytenoid cartilage. This one, pyramidal in shape. It has an apex. It has a base. It has an anterolateral surface. It has a posterior surface and a medial surface. See, a medial surface. The medial surfaces, they face each other. And the base articulates with the shoulders of the lamina of the cricoid. See? It's resting on the cricoid to form the cricoarytenoid joint. By the way, the joints are plain synovial joints. Allows gliding movement between the arytenoid and the cricoid. Now, it's important to know that it has an anterior process, and it's important to know the direction. This is an MCQ question. Anterior process, and because of it's attached to lots of muscles, so it's called because of attached to the vocal cords, it's called the vocal process. The anterior process is the vocal process. The vocal cord is a ligament. It's attached to the thyroarytenoid ligament, which is the true vocal cord. It has a lateral process. So it has an anterior process. It has a lateral process. The lateral process attaches to many muscles. So that's why it's called the muscular process. So we have a lateral muscular process. We have an anterior vocal process. We have an apex. We have a base. We have a medial surface facing the other medial surface. And we have an anterolateral surface, the one we are looking at right now. Now, on the anterolateral surface, you will find two, you can say, depressions for attachment of structures. The superior one will provide attachment to the vestibular membrane. We will talk about it now. And the inferior one it will be attached to a muscle called vocalis muscle. The vocalis muscle that relaxes the vocal cords, so thickens the tone of the of sound produced. So it has two depressions, one, the superior one for the vestibular membrane, and an inferior one for the vocalis muscle. Remember, the inferior vocalis, it's logic. It will be next to the vocal cords attached to the anterior process. Don't forget that. Okay? And the base, of course, it has a facet to articulate with the shoulders of the lamina. This is an important cartilage. It slides on the shoulders of the lamina and it goes medial and lateral, rotation. It has an axial movement, medial and lateral, and it has a sliding movement on the cricoid cartilage. Okay, of course, you expect that the sliding movement outwards and lateral rotation of the vocal processes will open the space between the vocal cords. And the opposite occurs when we pull the vocal cords medially, the vocal processes medially, and we pull the arytenoids up on the shoulder of the cricoid to be closer to the other arytenoid. Understand the movements of the arytenoid. Okay. What else? We have four other cartilages, two on each side. They are very small, club-shaped or conical in shape, and they are not apparent on the outside because they are enclosed in mucosal folds, which is the epiglottic fold. This one, see? The epiglottic fold between the epiglottis and the arytenoid encloses these two fine cartilages, see? The one articulating with the arytenoid is called the corniculate cartilage, and the other one is cuneiform cartilage in front of it. They are both covered by the mucosal folds. The mucosal fold, which is the epiglottic fold. They are there to provide support for the fold, because the fold, as you already know now, it's the margins of the laryngeal inlet, right? And it's in continuous movement where we swallow all the time. So this goes down and up all the time. When we swallow or when we eat, okay? So it has to be supported, this fold, by the two cartilages, small cartilages. Now, the cartilages we talked about, the thyroid, the cricoid, the arytenoid, the corniculate, and the cuneiform, they are of different types. There is a type of cartilage called the hyaline cartilage, which is pure cartilage, pure chondrocytes in matrix. And we have another type of cartilage which is hyaline based, but with adding of elastic fibers in it to make it more resilient and elastic. Now, the hyaline cartilage ossifies with age, but the elastic cartilage doesn't. Imagine the epiglottis if it was hyaline cartilage and got ossified. So we're all doomed. Actually, we will not pass the 20s, for example, or maybe 30s, because the cartilage will get ossified. It won't be able to move. It won't be able to go down and close the laryngeal inlet. So we have elastic cartilages and we have hyaline cartilages. Remember, the biggest, I can't say the biggest, but the first two cartilages, the thyroid and cricoid, which form actually the cartilaginous framework, the major cartilaginous framework of the larynx, are the hyaline cartilages. The rest are elastic cartilages, like the epiglottis, the cuneiform, and corniculate are elastic cartilages. You will be asked about this. I told you before, make a test Do a test for yourself. Go and solve some MCQs about the subject. You will find that everything said in the lecture actually are options in the multiple choice questions, optional answers that you can pick from. Okay, this is a beautiful dissection of the whole thing, the larynx. See, this is the lamina of the cricoid. This is posterior view, and this is anterior view. This is the posterior end of the posterior surface of the lamina of the cricoid with the two depressions for the posterior cricoarytenoid muscles. These are the lamina of the thyroid cartilage. This is the epiglottis with the pedicle attached to the back of the thyroid cartilage. It's a beautiful dissection here. And, well, if I ask you to give a name for this band, what do you call it? Well, it's between the epiglottis and the arytenoid. You can call it the epiglottic ligament, okay? It's so simple. This is an anterior view. See, here, see the two arytenoid cartilages facing each other medially. See that? They are on top. And this is the site of the joint, the cricoarytenoid joint. Here in the anterior view, see, this is the superior notch and the laryngeal prominence. This is the laryngeal prominence. This is the oblique line on the sides and remnants of muscles there. Remnants of muscles there. Okay? This is the hyoid bone, by the way. And this is the epiglottis projecting upwards and posteriorly. This is the anterior surface of the epiglottis. This is the posterior surface of the epiglottis, and note the fenestrations. Okay, I like this specimen. Now we're done with the cartilages. I hope that was simple enough. Now let's get to the membranes and ligaments. Membranes and ligaments are divided or classified into extrinsic membranes and ligaments, intrinsic membranes and ligaments. What does this mean? What does this mean? It means that extrinsic, they have extra laryngeal attachments. Intrinsic, they are totally attached within the larynx. Okay, this is the meaning of extrinsic and intrinsic. For example, the well-known thyrohyoid membrane, this one. Where does it attach? It attaches to the upper border of the lamina of the thyroid cartilage and the adjoining borders of the superior cornea and goes up to the hyoid. Now there is a trick here, and please concentrate. It's logic that the membrane goes up, so attaches to the inferior border of the hyoid, right? Well, this is absolutely wrong. It goes up medial to the greater horn. Means that it passes the thickness of the greater horn and reaches the superior border of the hyoid. See, to have a firm grip on the hyoid bone, it pulls it from its very beginning. See that? It's genius design. It goes up, passes the inferior border, passes the medial surface, and inserts in the upper border of the hyoid bone. Don't forget that, please. This is the thyrohyoid membrane. Okay, it of course attaches all over the greater horn and body of the hyoid bone. Now, where did we see that before? Yes, we saw that when we studied the pyriform. Actually, we just mentioned it with the laryngopharynx, the pyriform fossa. This is the pyriform fossa, right? We said it's bounded laterally by the thyrohyoid membrane and muscle, and medially by the quadrangular membrane or the vestibular membrane. We will study that. We will get to it now. So it's the lateral wall of the pyriform recess or pyriform fossa. What else did we say about the thyrohyoid membrane? Yes, it's fenestrated. It has openings for the superior laryngeal vessels and the internal laryngeal nerve. Don't forget that the thyrohyoid membrane is pierced by the superior laryngeal vessels and the internal laryngeal nerve that go inside and supply the mucosa of the pyriform recess. This is actually the nerve and blood supply, part of the nerve and blood supply of the larynx. So to recap, the thyrohyoid membrane it connects the thyroid cartilage with the hyoid. We mentioned the trick about the superior attachment, that it passes beyond the inferior border, goes upwards, medial to the greater horn and posterior to the body, till it reaches the superior border of the greater horn and body of the hyoid bone to have a firm grip on it. What else? That it forms the lateral wall of the pyriform recess and is fenestrated. Now what else? It thickens in 3 places. This is one, this is another one, and another one at the middle in front. Give a name to these thickenings. It's ligaments, okay? What do you call these ligaments? Okay, the thyrohyoid ligaments, right? Thyrohyoid ligaments. But these 2 are lateral and one in the median. So we have a median, of course, in front of the epiglottis. It's not the one I'm pointing at now. The median thyrohyoid ligament and 2 lateral thyrohyoid ligaments. Okay, don't worry about the names again. I'm stressing on that. See? Actually, the lateral thyrohyoid ligaments are the connection between the superior horn of the thyroid and the hyoid. That's why I said that it's the superior horn indirectly articulates with the hyoid bone, not directly, not like the way it articulates with the side of the cricoid. The lateral thyrohyoid ligaments and median thyrohyoid ligament. Okay? See, lots of things you can say about this membrane and lots of questions, of course. Okay. Now, what else? There's another ligament. We're still in the extrinsic ligaments. The hyoepiglottic ligament, this one. It's between the back of the body of the hyoid bone and the central part of middle part of the apex of the epiglottis. See, it supports the epiglottis, of course, the median hyoepiglottic ligament. What else? Okay, look down here. Of course, this is a longitudinal section of the larynx, so this belongs to the cricoid, which is the lamina, and this belongs to the cricoid. This is the anterior arch of the cricoid. Are you oriented now? This is the posterior, this is the anterior parts of the cricoid, this is the anterior arch. This is the arch of the, not the anterior, this is the arch of the cricoid, and this is the lamina. Between the cricoid and the beginning of the trachea. Now this is a very tricky question here. How does the trachea start? Starts with a cartilage or starts with a membrane? It starts with a membrane called the cricotracheal membrane. Cricotracheal membrane. It's this tiny membrane here between the cricoid and the first ring of the trachea. Cricotracheal membrane. Of course, you can't find, see, there is no cut section of cartilage posteriorly. Why? Because the trachea rings are not complete. Posteriorly, they are replaced by the trachealis muscle. So this is the cricotracheal membrane, which is another extrinsic ligament. So as example, or for the extrinsic ligaments, we learned the thyrohyoid, the hyoepiglottic, and the cricotracheal. Names are starting to pile up now. Okay. The intrinsic membranes Intrinsic membranes and ligaments, we said that they are called intrinsic because they have pure laryngeal attachments. They don't have extra laryngeal attachments. I means that it's all to the cartilages of the larynx. There's a very important fibroelastic membrane that's divided into two membranes. The fibroelastic membrane of the larynx is composed of the upper part, it's like the old ship sails, the quadrangular or vestibular membrane, and the lower part is the conus elasticus, the cricothyroid membrane. So we have the upper part, which is quadrangular, called the quadrangular or vestibular membrane, and we have a lower part which is called the conus elasticus or the cricothyroid membrane. But together they are called the fibroelastic membrane of the larynx. Don't forget this. Okay, conus elasticus. We can call it the cricovocal membrane. This is the cricoid cartilage. See, this is the arch, this is the lamina, this is the upper border of the arch, right? So this membrane, see, that has a superior free edge. This is the superior free edge of the cricovocal or cricothyroid membrane. Now the upper edges of the cricothyroid membrane, they get thickened and form the thyroarytenoid ligament or the true vocal cord. Now, what's the difference between true and false? True vocal cord means that this is the actual resistance to air produced by these two ligaments. False vocal cords, they don't produce resistance to air, and we will know why. So, the cricothyroid membrane or the cricovocal membrane attached below to the arch of the cricoid cartilage and goes up and has a free upper margin, attaches to the back of the thyroid, and the vocal process of the which is the anterior process of the arytenoid to form, give it a name, thyroarytenoid fold, right? It's the actually true vocal cord. Remember this. And when you put mucosa on it, it will be called the vocal cord proper or fold proper. When you remove the mucosa, it will be a ligament. When you put a mucosa, it will be a fold. Okay? Now this ligament, the cricothyroid ligament, thickens anteriorly to form a median cricothyroid ligament here. Now, from the outside, if you palpated the laryngeal prominence and went down with it, you will find a depression, then another elevation, which is the arch of the cricoid. See this depression. This is how you make emergency tracheostomy in someone who got choked, for example, and we can't pull the foreign body out or something. We need to establish an immediate airway before the patient dies. So you go through this ligament, the median cricothyroid ligament, which is between the arch of the cricoid and the thyroid cartilage. You pierce this area to establish an airway. Okay? Remember this. This is a kind of emergency tracheostomy. The permanent tracheostomy, ones used with malignant conditions of the larynx that occludes the larynx, you go down actually in the trachea, below the cricoid. It's an operation. It's done in the operating room. But this one is an emergency one. You can do it with a small knife in the street. Okay? Between the cricoid and the thyroid, you pierce the median cricothyroid ligament. So you got that. This is the conus elasticus. Actually, without it, there is no voice production. There is no sound, because we said the upper free border is the true vocal cord. Okay. See? This is the thyroarytenoid ligament, which is the upper border of the cricothyroid ligament. This is the true vocal cord. Attaches to the vocal process of the arytenoid. And when the arytenoids lateral rotate or slide on the lamina of the cricoid, the space between them widens. And the opposite occurs with medial rotation and upward displacement of the arytenoid to approximate each other. This will close this area, which is called the rima glutidis. We will study in part 2 the cavities of the larynx, and we will get to this. Don't worry about that. Okay, what else? Another intrinsic membrane is called the quadrangular or vestibular membrane. This is the vestibular membrane. All this, it's like a ship's sail. This is the vestibular membrane. See, it extends between the margins of the epiglottis and enclosing the two small cartilages and attaches to the arytenoid cartilage. Now, it has an upper free border and a lower free border. The other one, the conus elasticus, has only an upper free border. But this one, both borders are free. The upper free border, which you can give a name, ary epiglottic fold, right? And a lower free border. This is called the vestibular fold. Vestibular fold, okay? So because it's attached posterior to the arytenoid and anterior to the back of the thyroid, the same like the true, but so as not to get confused, it has another name. Instead of the thyroarytenoid fold, the vestibular fold, or the false vocal cords. Now, this free lower border attaches to the back of the thyroid, the same like the true vocal ligament. Posteriorly attached to the anterolateral surface of the arytenoid. We talked about this. We said that there are two depressions on the anterolateral surfaces, the surface of the arytenoid. The superior one for the vestibular membrane and the inferior one for the vocalis muscle, right? The superior one attaches the false vocal cord or the vestibular fold. Okay? So remember the things unique about the vestibular membrane. It guards actually the laryngeal inlet by its ary epiglottic margin. The margin encloses the two cartilages. It has an upper free border and lower free border and attaches anteriorly to the sides of the epiglottis and the back of the thyroid, the lower margin, posterior to the arytenoid cartilage to form a false vocal cord. Now, because of this way of attachment, the false vocal cord is not directly above the true vocal fold. Actually, it's superior and lateral. Means that if you take a look from the upper aspect of the larynx through a laryngoscope, going this way, you will see the two vestibular folds at the sides, but more to the midline, more proximal to the midline, more close to the midline are the true vocal folds. Okay? So, because of the attachment, they are superior and lateral to the true vocal folds. Now, another thing, this mucosa is all continuous. So it has a depression here made by the two free margins, by the upper margin of the cricothyroid and the lower margin of the vestibular. This area is called the laryngeal sinus. We will study it with the laryngeal cavities. Laryngeal sinus. And a laryngeal sinus on one side with the middle area, with the middle space, and the laryngeal sinus on the other side, this is called the ventricle of the larynx. So we have a laryngeal sinus, we have a ventricle. The ventricle is the two laryngeal sinuses together. Okay? See, Lots of things you can say about this membrane. Okay, that's the end of it. Thank you for watching.